and it came back positive.
So they got tested within a few hours of being admitted to us?
Probably within the first day or so.
All right, so can you get me the details on that, when the test was done at the hospital, right? And
Yep.
then when the test was done at Valley View?
Okay.
All right, thank you. Leader Amo, any questions?
No questions, Mr. Chairman.
Legislator Nagustakis?
Thank you. No questions.
Legislator Lujan?
No question, Mr. Chairman. Thank you.
Legislator
Chairman, we're
Sutherland?
getting feedback.
Yeah, I don't know where that's coming from.
No, thank you.
Lawrence's presentation, there was a lot of feedback there too, so. Legislator Sutherland?
No, thank you.
Legislator Tortel?
No, thank you.
Legislator Tui?
Yeah, Chairman, I just have a question for Lawrence because it was breaking up a little bit towards the end there
Right.
regarding the visitation. I know that I've heard that hospitals can start at their own discretion, I think on Friday. And I wondered where, nursing homes, they couldn't start. I heard him say that they think that they're outside, they can go outside and meet with family. Just if you could go over that again, Lawrence, and the possibility of in-person and inside.
So yeah, there's no visitation inside the facility. We have been getting residents outside, and then we're notifying the families when the residents are going outside. And the families can come and see the resident, from a safe distance, and you have to have a mask on. They can't, but they can't see that. They haven't physically seen their loved ones for quite a while, so we have started that.
And no word on when they can go back in, right?
No word yet, no.
Okay, thank you.
You're welcome.
Thank you, Chairman.
Chairman Brescia?
No questions, Chairman.
Leader Benelli? Any other
Thank you.
legislators?
No questions, sir.
Thank you. Any other legislators? All right, thank you, Commissioner. Thank you, Donna. Have a safe week.
Thank you.
Thank you. You
All
too.
right, take care.
All right.
Bye-bye.
Doreen, is Darcy with us or anybody from mental health?
No, they are not.
No, Chairman O'Donnell, it's Darcy. I'm on the line.
Oh, there she is.
Oh, okay, all right.
Yes, I apologize. I had to leave the office, so I'm joining by phone.
All right, that's fine. Just give us an update on the mental health side of the house.
Okay, so at this point, we're still fully 100% operational. We have brought more of our county staff back into the office, and we're transitioning them in. We appreciate all of their efforts during this time and their return to the office to continue their work. The state has extended the ability to do telephonic services for the Office of Mental Health and Office of Alcoholism Substance Abuse through July 7th. So at least until that time, we are able to continue with telephonic and telehealth services. We'll continue beyond that with certification from the state offices. We're hopeful that that will be extended a bit beyond because we still have some people who are in need of service who are not willing to come into the office. We will be prepared for return to office visits as of July 7th with some challenges to allow for social distancing and offices that aren't really set up. And I think that's across our system. We'll all be challenged by that. So we will be creative in being sure that we're still able to provide services and collect revenue for those services. Good news today, we have many families that are reaching out to us wanting to visit their loved ones who are in group homes with developmental disabilities or mental health issues, and the governor just did give permission today for those visits to occur. That will make many families and consumers of service happy. Of course, they have to follow all rules and social distancing criteria. We also, we're hopeful that we'll see some summer programming go back into place for children who are 12-month students who have special needs. So we're anticipating that we'll see some programming open up so that children can get back into their school settings. And I did send you all the brochures on the Hope Starts Here. We have officially put out the press release as of today for 311. Again, I've said many times, but appreciate the great work of Brendan Casey, Ellen Worsbicky, and their team over at Emergency Operations Center that helped to transition us to a 311 three-digit number and continuing to host us as the crisis continuum. In these, very tense times, it's more important than ever that we have such a good relationship with our first responders. Our mobile response team has been working with our law enforcement in Orange County for 3 decades, and crisis intervention training is present in, if not all, nearly all of our police departments here across Orange County. So really good collaborative effort that continues, and appreciate that work. Additionally, I sent you the markups, the flyers for the Text for Teens with the Mental Health Association working together with us, put a marketing campaign out to try to reach young people who may not have eyes and ears, and they might not be safe in their own homes. So an opportunity for them to reach out and connect through Text for Teens and have a place where they can get support and hopefully intervention if needed if they're feeling unsafe. So I think that covers it. Oh, I will say that currently our OD map shows a pretty significant increase in fatalities related to overdoses. We want to confirm those numbers with the medical examiner's office just to be sure that there's no error. But this pandemic, as well as bail reform, I think have collided to really bring a crisis to our door again around overdoses. All of the improvements that we put in place and the strides we've made last year to reduce those numbers, we're seeing them go right back up to previous year numbers. So we're working diligently to address that, and we'll pursue all of our partners to put additional programming in place to try to reach people that traditionally we reached through the criminal justice system that we are not connecting with at this point. So that's my update. If you have any questions.
Okay, thanks, Darcy. Leader Amo?
No question, Mr. Chairman.
Legislator Anagostakis?
No question, thank you.
Yeah, we're all getting this feedback again. Legislator Lujan?
No questions, Mr. Chairman. Thank you.
Legislator Sutherland?
No questions, but I just wanted to say to Darcy how I know so many of my students have really, and their families especially, have really appreciated the telehealth and what a difference it has made for them during this time. So everybody's doing a great job.
Thank
you. Legislator Tortel?
No questions. Thank you.
Legislator Tui?
Yes, Chairman, I just wanted to see about, Darcy, are there other than the flyer, what kind of marketing will be done for 311? Is that going to get a full rollout, or is this it so far?
We have, yes, that's a good question. We were, the 311 number happened about 6 weeks ago, but because so much attention was on COVID, we kind of held off the rollout. So it's been live and active for some time. But we put out the press release today. We'll put out another press release just to reinforce. And there's also marketing material that was purchased some time ago, like mugs and stress balls and wristbands. So and also decals for the cars. And so we will be putting all of that out into the community. At this point, we think it's important to get the word out. We have seen an increase. People have always called when they have mental health issues. We really want to target the substance use community so that we find an increase in the number of people who are reaching out and then connecting to service. So and there's also billboards. The billboards are out with the 1-800-832-1200 number. That will be replaced with the 311. And there have been radio ads that have been playing continuously on a number of radio stations. The Mental Health Association has led with a collaborative team, a marketing team, those efforts.
Pushing the 311.
Correct, yes.
Okay, and when you said press releases, they send them to Spectrum and Optimum and News 12s and those guys?
You know, I'd have to ask Justin Rodriguez puts that out for us. So I'm not sure exactly how they go about if they get sent to, or what the distribution list is they get sent to, but I can ask that question.
Yeah, if they can get them out there and get a quick story too. I mean, if you're going to roll it, let's roll it, right?
Agreed. We want it far and wide. We have people use
right.
it. Really, I have to tell you, during the pandemic, they received as many as 200, 250 calls a day, just COVID-related specifically. This past weekend, those numbers have gone down. They only had like 27 calls for the whole weekend on COVID. So it just tells you that people have the information, feeling more comfortable, and we can feel more secure that our community is stabilizing a bit around the pandemic.
Okay, thank you.
Sure.
Chairman Brescher.
Yes, Chairman, on that 311 phone line, I would also ask that Janet and Rob do something from the legislature, because our Facebook page should be up and running now. And I know Rob was pushing for that for a very long time, and Janet is the chairwoman of that committee now. So maybe they can do a little release on the legislature's page on that too, to try to even get more exposure, if you will.
Very good.
Very good. And we'd be happy to send you over what we have too. You can use it, or you can create your own, whatever you prefer, okay?
Good, very good. Thank you.
Leader Benelli,
No questions, Mr. Chairman. Thank you.
other legislators. Thank you, Commissioner. Appreciate it. Third on the agenda is the Health Department, Commissioner Gelman. And 3A, request to accept and appropriate grant funds from the New York State Department of Health for the period 7/1/20 through 6/30/21 for the Public Health Emergency Preparedness Program grant in the amount of $235,654. Legislative request number 099. Do I have a motion?
So moved.
So moved, Tortel.
Lujan.
Second by Legislator Tortel. Thank you. Commissioner Gelman, are you with us?
Yes, I am. Can you hear me, Chairman?
Yes.
Good evening, everyone. Pretty much this is self-explanatory, and as it states, it's the Public Health Emergency Preparedness Program grant for the period aforementioned 7/1/20 to 6/30/21.
Any questions? All in favor?
Aye.
Aye.
Opposed?
Aye.
Carried, unanimous. Thank you. All right, could you give us an update on the Health Department, Commissioner?
Absolutely. Thank you, Chairman O'Donnell. As you are all aware, the Orange County Department of Health has been fully active in its response to COVID-19. Most of the department staff has been deemed essential in either their response to the pandemic or in activities that are continuing in the county, such as food service, public water supplies, and intervention services. Also, the syndromic surveillance monitoring that is always happening, has been happening throughout the pandemic response. We are encouraged to see the number of positive cases steadily decreasing, along with the number of deaths in Orange County from COVID-19. As a matter of fact, it's been a number of days since we've reported a death, so that's a great indicator. As of today, we have 10,668 COVID-19 positive residents in Orange County, with 63,124 total tested. to date. There have been 758 tested yesterday for a total percent positive test at 16.8%. If you recall in my initial reports, that total test positive percentage has been around 34% or so from the number tested. We have had 473 deaths as a result of COVID-19. And in terms of our Emergency Operations Center, as of 2 weeks ago, the Department of Health has largely moved out of the Emergency Operations Center, is now able to conduct most of the day-to-day COVID response work from our main office. Our Public Health Emergency Preparedness Coordinator continues to work with nursing homes, hospitals, and various medical facilities to help with their needs and providing PPE and addressing their other needs. The nursing epidemiological divisions have been working 6 days a week collecting laboratory results, calling residents with their lab results, tracking data, and now working with the New York State Department of Health on contact tracing. The department is no longer utilizing staff from other departments to help with data entry and contacting residents, as these departments have also moved into resuming operations. We are currently in phase 2 of reopening efforts countywide, with phase 3 coming up shortly. Contact tracing has proved to be very challenging. I will have our Director of Epidemiology and Public Health Planning give a more specific update on that response. So Jackie Lawler will join us shortly. The Environmental Health Division, there has been an issue with timely guidance documents from the state with regard to recommendations on issuing permits for summer operations. So a lot of the seasonal activities such as children's camps, pools, beaches, food service, public gatherings. However, the Environmental Health Division is working closely with operators to get them into compliance. That has been a bit challenging as well, and the guidelines and the governor's executive orders leave us certainly with many questions, and they tend to vacillate day to day on regulations. As far as intervention services, on June 5th, the governor issued an executive order allowing special education services to operate this summer. We are receiving a tremendous amount of questions on this topic. So thus far, just a synopsis, the order appears to only apply to preschool special education services. So that's ages 3 to kindergarten, which is our 3 to 5 program. The way the order reads, it makes it sound like it's a local school option. However, we are seeking clarification on that from the state. They're also are convening a meeting with our schools. We have told our bus providers to get ready to serve students, and our county early intervention and preschool special education staff are working with providers and with families. They're speaking regularly with families. However, they are working closely with providers to develop frequently asked questions list and working with schools to provide any support that we can to families. We have had a number of questions previously with regard to some of the more granular level data. I will touch upon this just briefly and hand this over to Jackie unless there are any questions. So as far as the confirmed and probable COVID-19 deaths by age group in Orange County, New York, and that's reported as of June 5th. So that's a sample size of 419. We have not caught up with that 473 number that I mentioned previously, because this data is as of June 5th, so that N number is 419 total. So for the 419 total deaths reported by June 5th, in the age range from 18 years of age to 44, so 18 to 44, we have had 19 deaths in that age category. And unfortunately, not all of them were with comorbidities or underlying health conditions. Quite a few were healthy individuals that had COVID-19. For the age ranges 45 to 64, that included 76 deaths as of June 5th. Age range 65 to 74, that included 93 Orange County residents. And 75 and over included 231. Now, I will say, as far as confirmed COVID-19 cases, again, by age group in Orange County as of June 3rd. So this is a smaller cohort size than the total that we have currently. But as of June 3rd, for the reported number of cases, and I believe that was 10,533 total number of cases as of June 3rd. The data for 0 to age 17 has been 449.
We lost you, Doc.
Looks like your mood is, there you go.
Can you hear me now?
Yes.
Okay, dokie. So
Back up
was
a
it
minute.
0 to 17? So
Start
for
from there, that's fine.
Thank you. Confirmed COVID-19 cases by age group in Orange County as of June 3rd. For age categories 0 to 17, there have been 449 confirmed COVID-19 cases in Orange County as of June 3rd, and that includes a total sample size of 10,533 as of June 3rd. So age range 0 to 17, that was 449 Orange County residents. Age 18 to 44 has actually been our largest category, age 18 to 44 in Orange County, with 4,628 residents. Age group 45 to 64 has been 3,728. 65 to 74 has been 847, and 75 and over has been 881. Are there any questions before I hand it over to our Director of Epidemiology?
So has anybody from the Attorney General's office contacted you regarding the investigation into nursing homes?
No, they have not.
No. Okay. And how many nursing home deaths have there been in Orange County?
I don't have that information available, but we can see if our epidemiology division has it.
Okay, thank you.
Thank you.
Leader Amo,
No questions.
Legislator Anagostakis.
Yes, Mr. Chairman, a question.
Go ahead.
Thank you. Doctor, do you happen to have the statistics that you gave out once in a county call about you looked at a particular week and you went back 3-4 years and you found the average of deaths during that week? Do you have those statistics handy by any chance?
Mortality for the week of April, I believe 6th to 13th. We can send that out.
Okay, you don't have it available right now?
I don't have it in front of me, but we can definitely send that out.
Please send that out. I've got questions on that. Thank you very much.
Absolutely. Thank you.
Legislator Lujan.
Thank you, Mr. Chairman. Yes, I do have a few questions. The first one is in regards to a recent report about it seems it's called dexamethasone. I don't know if you heard about it.
Steroid.
Yeah, it's a steroid. So what do we know about it? Is it too early for us to really know how impactful it could be, or how effective it could be for us to use locally?
So it's a bit early to say because they're I'm not sure if we're not.
Sorry, say that again.
Okay, can you hear me? I think that's better. So as far as hydroxychloroquine and chloroquine use, the FDA has revoked its emergency use authorization for the two malaria drugs, chloroquine and hydroxychloroquine, for the treatment of COVID-19. From the beginning of the pandemic, there have been over 60 pharmacological interventions that have been broadly studied, dexamethasone being one of them. The real front runner has been remdesivir, which is an antiviral, an actual antiviral medication. However, the preliminary studies have come out with mixed outcomes. So we're still awaiting actual randomized clinical trials on those. And dexamethasone is just one of those 60 plus pharmacological agents, and it's very, very soon kind of in the process to really tell if there's any efficacy associated with it. And as we've seen with the anti-malarial drug and then the highly touted antibiotic, again, any of those pharmacological agents to be used to treat a viral infection is questionable at best. So we are still waiting to see what will be published as far as actual viable clinical studies. In terms of vaccines, I will briefly mention that. There are currently over 125 vaccines in research in various phases of research, completely different organizations, but over 125 vaccines. Seven of those have entered phase 1 clinical trials, 7 have entered phase 2 of clinical trials, and 1 has actually finally made it to phase 3. So although that's looking promising, we still have to wait and see what evidence actually shows on that as far as efficacy, safety, so on and so forth.
Thank you. My second question was in regards to a conversation we all had several months ago. There was a report that we were seeing a higher level of infection amongst communities of color, particularly the African American community and Latino community. And we had asked for data and information about that. Is that something we've been able to collect thus far?
Yes, we have. And
Jackie
has that in front of her, so she will definitely address that.
Wonderful. And then my last question before you each pass it on is in regards to reopening. So we're seeing not only across the country, but also in other countries across the globe, that as some locations are opening up, there is now the concern of a second wave and a third wave. And obviously, I think we all want to make sure that businesses are able to come back, and we want to make sure that people are safe. But the big concern is also what happens if we open up too quickly, and what's going to happen to our communities. What are your thoughts on how quickly we are opening up? And do you think that we are preparing sufficiently for a potential second wave in the fall?
So what I would like to, you bring up a tremendous point. Beijing has actually closed down viably a number of their provinces currently due to a very large outbreak. So that in and of itself is concerning, because that anticipated second wave seems to be potentially coming in earlier than originally anticipated. And given the numbers we are seeing in the states that did not essentially quote unquote close down, there is some room for alarm in that regard. Also, I will mention the fact that the originally anticipated second wave was supposed to come in around November, which would coincide with our flu season. And I think I briefly mentioned it last time, but flu vaccination historical data has not been great to begin with. We have had compliance across the state, without even mentioning local data, for individuals under the age of 55, that compliance rates have been at an all-time low, vacillating somewhere around the around 30 to 35% vaccination rate, and that is given the fact that a large portion of that cohort are the mandated healthcare workers that actually have to be vaccinated. So flu vaccination is alarming because we have the data on the complications stemming from the flu. So that's something that has to be addressed as well, because if that second wave is to coincide with the flu, the healthcare industry will see a lot of those complications come in concurrently. Also, compliance as far as the use of masks. We have contemplated even issuing a video on how to use masks appropriately, because from what we are observing in masks, there is non-compliance essentially with the use of masks and social distancing. And at best, when masks are used, I've seen them being utilized all over the place. And at the end of the day, you do have a mask that is essentially a magnet for contaminants. And when that is not washed properly, that is not put on and taken off properly, when that is not stored properly, I've seen them be put back in their bags, in the backs of people's pockets. People are touching them, which defeats the entire purpose of using that mask. And if you recall us originally early on in this pandemic, the CDC's recommendation for the use of masks to begin with had to do with this very fact, where the population at large was not well equipped to actually don and doff masks properly on a daily basis for daily use. That's why the initial recommendation was that social distancing measure with proper respiratory hygiene, if you recall, and washing hands. Masks, as a general rule of thumb, unless we have 100% compliance, as we've seen in Singapore, South Korea, the outcomes tend to be not great, because with 50-50 compliance, you really have that contamination happening where you're passing on those droplets onto the individual wearing the mask. And then once that individual is constantly adjusting the mask on the contaminated surface, which is external, or taking them off by that contaminated mask, you have that propagation for disease. So there are a number of educational moments that have to happen, and with the second wave, there is a potential. As far as opening up, we are following the phases for reopening. Clearly, with the protests and with other events outside of sort of the realm of at least my control, but our general control, mass gatherings of any sort, obviously from a communicable disease perspective, strictly from a communicable disease perspective, are clearly counterintuitive to actually combating this as a communicable disease, and absolutely have not helped. But we have not seen a direct correlation to a spike just as yet, but we are following that closely, because if we are to see a spike, that would happen tentatively around 3 weeks out from the onset of a lot of that congregational activity. We are following the guidelines fairly strictly, at least on the health department level, and we are following up on all pause complaints or any other complaints received.
Thank you very much, and I appreciate you also talking about the face masks and everything you're all doing. One thing I don't know if you might have noticed is that I think New York City did a report about the correlation between protesters and whether or not there would be an increase, and actually they saw that there wasn't any data that would indicate that was the case.
Well,
so that is actually pretty telling.
We'll see on that data. Thank
Well,
you.
thank you.
That is definitely our friend.
Well, we'll see on that data what happens there. So one question I have, Commissioner. So you just brought up how many people don't wear the mask correctly, right? So what percentage would you think today of people wear the mask correctly?
Clearly, this is highly subjective, but from what I have observed,
I'm just looking for your professional opinion.
From what I have observed directly, I would say less than 50%.
So less than 50% of the protesters are wearing those masks correctly. That's
Not
a fair
just
statement?
protesters, but individual
anybody.
public that I've observed. Yes.
All right. Okay.
I think the
Legislator
the comment
Sutherland,
was specifically to
Legislator
everyone.
Sutherland, do you have any questions?
No. Thank you.
Legislator Tortel?
No questions. Thank you for all your work, Dr. Gelman.
Thank you.
Legislator Tui?
Yes, Chairman. Doctor, with the influenza, the season that you talk about, if it overlapped with a second wave, when does that, I know that it's typically in the fall. Do they have the vaccination for that now, or have they determined what strain it is this year yet? Or when does all of that kick in? We're only about 65, 70 days away from September. And if I remember correctly, I've gotten my flu shots that early.
We don't have that just as yet in terms of vaccination, but this is something that is constantly brought up to the New York State Department of Health, especially for this year, more than ever. It's imperative to receive that early on and to ensure an adequate supply so that when individuals are actually anticipating being vaccinated, they actually have the supplies to be vaccinated in a timely fashion. So not yet. Typically, the strain starts out in China. I don't know if that's a surprise or not, but I mean, factually, it does start out in China. And a lot of once those strains are isolated, they provide the UK and Australia, and it kind of migrates down from there.
So would you say that normally in a normal year, we would already be at that stage with it coming, or are they, is it not coming through those other channels yet, or we just haven't been on it? Are we behind the 8 ball at all?
We're not behind in any way. We're kind of, we're following the regular trajectory and the regular timeline. It's just that I'm kind of very hopeful that at least our messaging and campaign can start early on, that to ensure that once the vaccine is here, a lot more individuals than typically receive vaccination, if in no other season, just for this year.
Okay, thank you.
Thank you.
Chairman Brescia. Leader Benelli.
No, thank you, Mr. Chairman.
Any other legislators? All right, we'll hear from Director Lawler.
Thank you.
Thank you all for having me today. I appreciate it. First wanted to just thank you for approving the position. In addition to that, and backfilling it with another epidemiologist. Before COVID, I can unequivocally say that no one knew what an epidemiologist was, but now everybody knows that term and what they actually do. So I'm really grateful for all of the positions that had granted, and really grateful for our leadership that was able to advocate for us. We have never seen this type of public health challenge in the last 100 years. We received almost 10,700 cases, as Dr. Gelman had pointed out today, within 3 months. That's not something that we normally process. So in addition to the epidemiology positions, we have about 11 other staff that I'm overseeing from different divisions, including environmental health, community health outreach, and our nursing division that is being pulled for these data activities. Every one of these numbers is a case, is a family, is a story, and a set of circumstances. So it's very important to us that we continue to get that right and make sure that we give every attempt that we can to investigate everyone, as well as make every attempt to reach out to them so that we can get them the things that they may need. Unfortunately, there has been some challenges with the state. I know Dr. Gelman had mentioned it before. As we move into contact tracing, ComCare, these types of things are very usual for the health department in terms of contact tracing, but for ComCare and some of the other demands that the state health department has put on us has made it a little bit more difficult than it normally would be for other communicable diseases. So we do take that in stride and continue to adapt and change and do everything that they ask us to do, in addition to doing the public health thing and the right thing for surveillance. I do want to leave time for a bunch of questions, but I know the question was brought up particularly when it comes to race and ethnicity. So I do have some of that information right here. There are a number of missing data from this particular poll that was when they generated the report in early June. So what we are trying to do, because people either did not elect to answer the question with us, or it was not reported on the lab, we're using some of our other mechanisms, some of our other ways of getting information through the normal communicable disease routes in order to try to fill in those gaps to make sure that we are not underrepresenting or overrepresenting one population over the other. So I can tell you from about a sample of 5,506 individuals that we did have race information for. Again, that is a pretty decent sample size. 56.7% identified themselves as white, 17.4% identified themselves as Black, 23.8% identified themselves as other, and 1.8% identified themselves as Asian. I did include some of the smaller Pacific Islander, Native American, Alaskan, other. They were very small percentages. So we do have obviously about half of those individuals who identified themselves as white. It's still a lower percentage than those that you see overall representative of Orange County residents. So we are overrepresented in terms of people who identify themselves as Black. So 17.4%. When you look at census, it's usually around 12% or so for Orange County. Also, I did it for race and ethnicity as well. And when you look at that, It was about a sample size of about 5,000. Again, a decent sample size of those that had answered the question for us. You're looking at 46.5% identified themselves as Hispanic, which is obviously about twice as many individuals who are in Orange County. So we do know that our Black and Hispanic populations are disproportionately affected by COVID, which we have seen in every other community, not only in New York State, but across the country as well. So I wanted to answer that question for you. I think one of the challenges that we're going to have is going to be in terms of integrating, we have been solidly COVID for the last 3 months, but we do have other communicable diseases that we do focus on. We have sexually transmitted infections, which are unfortunately increasing as more people continue to get tested. We've had a 39% increase in syphilis cases as compared to last year from just this year. So we know that is a concern because there was even a small period of time where people really weren't getting tested in the first place. This is tick and mosquito season. I know many of you from my work with Lyme disease and our mosquito surveillance program. So we're continuing to work on that, as well as gastrointestinal illnesses. I'm sure many of you saw that there was a recall of ground beef, E. coli, that came out just yesterday. And so we tend to see an increase prevalence of gastrointestinal diseases in the summer months. And of course, there's rabies with our nursing staff as well. And those, of course, are just the communicable diseases, not everything that we do at the health department. So I do think that will be a challenge for us, but we are always up for the challenge. Flu season, as everyone mentioned, will also be very interesting this year. So we're really going to have to work hard to make sure everyone is vaccinated for flu, in addition to some of the COVID challenges. So I'm sure there are questions, so I will stop there and pause for questions.
All right, so what kind of outreach are we doing in the Black and Hispanic communities? Seeing as go ahead.
Oh, yep. So our community health outreach division has actually done a lot of this in Middletown and Newburgh in the past 3 to 4 weeks, I would say. They're there at least once a week, handing out masks, handing out education. They've been really prevalent in those communities. We have offices in both of those areas. So I know in Middletown, we have actually coordinated with the city of following where they do their distributions for food for lunch, for school lunches. And they've been very successful at outreaching because unfortunately there are a lot of people in need who also need to be fed. And we've been following them because they get really good crowds. So it's been a really good turnout in those areas.
Is there anything more that we can do?
I think there's always more that we can do. I'd like to work with our Director of Health Equity on that as well. I would like to put together, once we actually backfill our epidemiologist position, I'd like to put some additional statistics involved, highlighting some of the disparities in the two communities, especially once we start to get fuller data sets. As fortunately the number of cases go down, we can work more diligently on cleaning the data, making sure everything is the way it's supposed to be and getting all of the missing information. So I hope that we can put that information out there to lead to actionable items in the community.
Okay, so what's the problem with backfilling that position? We approved that position, I'm pretty sure 2 months ago at least.
Oh, I don't think there's a problem. We're just doing the canvassing and interviewing and getting somebody in here.
Well, to me, that's a problem. If we approved the position 2 months ago, we're in the middle of this crisis, okay? We shouldn't be waiting 2 months to backfill a position like that. If it was critical 2 months ago to create the position, I find it pretty disturbing that it hasn't been filled in 2 months. Okay, so hopefully next month it's definitely filled. All right.
That would be great.
Leader Amo.
Thank you, Mr. Chairman. Great report. I appreciate all your work. The analysis behind the scenes is so critical to where we're going as a county in terms of public health. Excuse me. You know, when I look nationally at the way we're reopening, and I hear states are having great problems with the reopening, and to say that that's not quite successful with it, it occurs to me that really going forward for all of us in Orange County really is dependent upon vaccine, or what that word I hear a lot is herd immunity. I'm really not sure what that is. So I'd like to have you talk a little bit about herd immunity with me. I've heard people say, I've heard some report in the paper, 65% of the population means you have herd immunity, but I don't know what it means. So I'd ask you to do that for me and sort of, talk about how we factor that into looking at how prevalent the disease is likely to be. And Mr. Chairman, I forgot, I really appreciated before you answer, I really appreciated Dr. Gelman talking about the mortality rates. They're really quite good. And I know some of us in this committee are glad to report in that we're part of that 65 to 74-year-old group. And we're here and we're happy for that. So if you could address those questions. Thank you, Jack.
Sure, no problem. So herd immunity is the concept that enough people in a particular community have either immunity through vaccination or they receive the disease themselves and there is a built up, so when their body is exposed to it again, that they don't actually become ill. So if you have enough people around you that are unable to become ill, the virus doesn't have a host to go to and to spread to other people. So that's always why there's like a threshold for certain diseases. I think part of the issue is that we don't know how long immunity can potentially last for this particular disease. It's just because it's so new. It's only 6 months old. I think part of the other issue too is that there are over 200 types of tests for antibodies, and not all of them have been validated. I do trust the Wadsworth test, which has been validated from the New York State Department of Health lab, and they did antibody testing in the Hudson Valley. And the results that had come out on that on 6/13 was just under 10%, so about 9.5% of those in the Hudson Valley that had participated in the study were shown to have immunity, which unfortunately was much lower than the statewide of 13.4%. So we're a little bit nervous about that. And I'm just a little bit nervous about some of the other antibody tests that are out there, mostly because I don't have the data, right? Obviously, I'm very data driven and I want to see how well these tests are actually doing. So I'm just trying to spend some time with looking at how valid they are. So I greatly appreciate the governor releasing those results for the antibody test, because that was communicated by Wadsworth and conducted by Wadsworth. And I do trust that test.
Just a quick follow-up to that is that, when the county put out the map of I'm talking about Orange County, and showed, the prevalence of tests, the people who are found positive, the deaths, et cetera, we know about on the website, on the dashboard. Is there any way to look at that in terms of saying, this entity, I mean, let's say City of Newburgh has got an awful lot. A large percentage of the population has been identified as having tested positive. Would they be more likely in other communities at becoming herd immune because a large percentage of them? Do we think about that statistic in that way?
It's hard to know that right now. I would like the answer to be yes, but the answer is I don't know. And so it's hard to really know what the correlation is between those individuals who are PCR positive, which is what's being represented on the map, and how that turns into 3 months down the line, 6 months down the line in a potential second wave, whether or not those individuals will be immune to if they encounter the disease again. So the answer is I'm sorry, I don't really know.
I didn't know, I'm not sorry, I didn't know either, but I figured you would. But the point, I think it's important as we hear people talk about, the second wave and the third wave, for us as a county to begin to think a little bit about that process of herd immunity. I mean, this may be a silver lining for Newburgh. It says, my God, we've had so many cases. Well, guess what? Next year, in the fall, if it comes back, we may be at the bottom of the list.
It would be hopeful.
Yeah,
it would be hopeful.
Okay, thank you very much.
Thank you.
Legislator Anagostakis.
Thank you, Mr. Chairman. I want to go back to something that Mr. Lujan brought up and talked about, and maybe just make a quick comment, and maybe the doctor can come back next month with more research, because I'm not sure that she followed the events today. Remdesivir had not shown efficacy in preventing deaths, basically. But the steroid that Mr. Lujan was talking about was based out of a study in Britain that came out today that showed a 30% decrease in deaths on intubated patients and 20% decrease on people on oxygen.
That's accurate.
And so that one was very promising. If the doctor can give us information on that next time, that would be great. Thank you.
We will absolutely do that, legislator. And I just wanted to mention with remdesivir, there have been a number of trials, and the reason they were 50-50 preliminary trials did show tremendous improvement with preliminary treatment with remdesivir as an antiviral. However, the later studies, which are kind of the broader generalized studies, were not so conclusive. As far as dexamethasone, it's a newly emerging treatment trend. And if you recall at the beginning of the pandemic, the use of steroids was actually contraindicated, and dexamethasone being in that steroid category, I really have to review the data. So I have been following it quite closely.
Did you happen, let me interrupt. Did you see the data that came out of Britain today? It was a 2,000 patient study and a 4,000 patient placebo. You saw those results?
Yes, however, it was not peer reviewed just as yet, so I'm following that very closely. And
Okay,
again,
good.
the fact of the matter is, because initially the steroid use was contraindicated, I'm still kind of, I'd like to see more data on that. But we will absolutely follow up.
There was a lot of talk about that today, that it was contraindicated in the beginning, and all of a sudden, this is showing that maybe that was overlooked incorrectly, and this could be a path to go down. So just look at it. And,
I will mention that hydroxychloroquine initially, chloroquine, azithromycin, and a slew of other pharmacological agents have been proposed initially, and we've been fairly steadfast with the data that we've been putting out. So I will definitely follow up on that and give a more detailed report in the next committee meeting. Thank you.
Great, thank you.
Legislator Lujan?
Thank you, Mr. Chairman. I just wanted to go back to the response, and I appreciate you having that data. I think that's really, really important. And I actually want to say, Chairman Brescia and myself, we were actually in the city of Newburgh a couple of weeks back, helping out with the Department of Health, and I've continued to do so here in the area. And your staff has been phenomenal. I mean, really, just that outreach team has been really, really great. And they were going door to door, having conversations with individuals, letting them know about services that are available to them. And I just want to say, when we talk about essential staff, I mean, you are all on the front lines, and we admire all the work you're doing. That being said, I want to also just highlight, and I'm not saying anything you don't know, the city of Newburgh, still last I checked, had the highest number of cases. We are about 55% Latinos, the second largest African American. So we have a very, very large population. That's specifically the one that you just highlighted is being hit the most. And again, that's not any different from what we're seeing across the country. But again, it is what we're seeing here. And you mentioned that we could be doing other things. So I'd like to hear that. What other things would you recommend we could be doing? Because I think that's where I want us to be able to go to.
Well, you did mention a couple of them when I asked you.
She did.
So repeat them in case you didn't hear them.
Yep, that's okay. I appreciate it. I saw those photos when you were in Newburgh. I am a Newburgh resident. I usually worked in the Newburgh office before COVID response came from, so this is an important community to me. I do think in order to address some of the COVID and the health inequalities, we have to take a look at the social determinants of health, which is something that I have been talking about in the community at least since 2012, 2013, when my position kind of expanded. I apologize, I'm getting feedback. So I do think that in order to really address some of the COVID things, yes, we should be out in the community. Our community health outreach division has been absolutely incredible. They are not only on the front lines, they are here taking calls. They are individuals who are in my data room that are helping sort out data. They are making calls to case investigators, and we've taken at least 3 or 4 of them that can also speak Spanish, and they've been talking to our communities that primarily speak Spanish as well. So they are absolutely incredible, so I wanted to acknowledge that as well. And so I think in addition to not just handing out in the health education, which is super important, we really have to talk about some of the structural things that we need to do to address health inequities. And so that goes across the board in terms of better access and addressing transportation issues and addressing job security and addressing food insecurity, which is something that previous to this is also something I'm working on. So there are some things that I think eventually will show up in having people who are able to or not as impacted by communicable diseases if we address some of those social determinants of health, which is something that I am personally committed to, and we know that our staff here is as well.
Well, we're very lucky to have you, and we appreciate you giving us that information. One last question, not so much for yourself, but maybe for the commissioner, is about the health equity coordinator. You did mention that you will be looking to work with that individual. Do we have any data from what they have seen? I don't actually know where they're based out of. Are they based out of Middletown, Newburgh, Goshen?
So yes, they are based out of Newburgh, and they work closely with community health outreach and all of our other divisions, especially with disseminating information and ensuring that the information is getting out there. I did want to briefly mention that in terms of other communicable diseases that I mentioned earlier, we just issued commissioner orders for day camps to maintain immunization records for the campers and for the staff as well, because we all remember last year the measles outbreak that we've experienced. So in order to really prevent that, we're ensuring that the camps continue to maintain those records on file. This is in accordance with our local sanitary laws, but also in line with the commissioner orders that we issued last year. But this is sort of preemptively due to the fact that due to the shutdown, and we've all discussed kind of the implications of the shutdown long-term, both short-term and long-term, but we are seeing lowered immunization rates across the board for all immunizations, just due to the shutdown and to the inability of individuals, children, family, parents to present to a provider in the past 10 weeks or so. So we have seen immunization rates dwindle down to about 50%. So preemptively, we are working on prevention, not just on the COVID-19 front, but simultaneously to avoid the measles scenario that we've seen from last year. So I just wanted to briefly mention that. But as far as health, we're working on all fronts.
Thank you. Thank you to both of you, to your entire staff.
Thank you. So, Commissioner, how long has that position been stationed in Newburgh?
From the very beginning. From the very beginning, since it was advertised, it has been stationed in the Newburgh office.
So a year, 2 years, what?
It'll be 2 years in November. It will be 2 years in November.
Okay, thank you. Legislator Sutherland.
No, thank you.
Legislator Sawtelle.
Playgrounds will city enters phase 2 reopening.
I have no questions at this time. They've all been answered. Thank you.
Thank you. Legislator Tui.
Yes, Chairman. This is for either the commissioner or the director. I'm not familiar with the health equity position. Can you explain what that is exactly?
Sure. Do you want me to do it? Go ahead. Okay. So the position of the Director of Health Equity was created, I think maybe about 3 or 4 years ago. And the idea is it for that particular director to work across all of the divisions to ensure health equity in all programs. So part of it, her conjunction work with me, is to get some of the data pieces and then develop some policy changes and some program use around those inequities that have been identified through data. A lot of which we have done, which I am also in charge of, which is the community health assessment and the community health improvement plan. So that process was just done at the end of last year. And so we outline all of the disparities as much as the data are available. And then she takes a look at that information, works with community members, and develops kind of policies and programs, kind of a health in all policies approach, which is what she's been taking, and taking a particular interest she does have in housing. So those are just some of the things that I know that she's working on.
Okay, thanks, Chairman. Can we get for the next meeting, maybe a list of some of the policies that have come forth? and successes.
Sure. You want to send an email to the director? Ask
Sure.
specifically what you want?
Yep.
Could the health equity person maybe come and speak before the committee? Mr. Chairman?
I'll look into that.
Thank you, Mr. Chairman.
That'd be good too.
Thank you,
Chairman,
Director.
Chairman Brescia,
Nothing, Chairman.
Leader Benelli,
No, thank you, Mr. Chairman.
any other legislators? Thank you. With that, the desk is cleared. Motion to adjourn.
Sutherland makes the motion.
Thank you.
Hotel second.
Thank you. Enjoy the evening. Thank you
Thank you.
very much.
Thank you, Chairman.
Thank you, Mr.
Thank you, Mr. Chairman. Stay safe.